your name at the top of his list. And the Statue of Liberty started shaking her fist. And the eagle will fly, and it's gonna be here. I brought to you courtesy of the red, white, and blue.
It's time for Veterans Issues, the show that brings you information about veterans, military, and their family. Now here's your host, Ken Rollins.
Welcome to Veterans Issues, and we are brought to you by the Red, White, and Blue. Today's guests are from the Bradford Health Services, and Kathleen Saucier and Zach Ludwig. We're going to talk about some things near and dear to my heart and near and dear to yours out there. If you're a veteran or military, stay where you are. Get a pen. Welcome back to Veterans Issues. Ken Rollins here, and we're going to talk today to Kathleen Saucier and Zach Ludwig. They were the Bradford Health Services, and they're not out in Birmingham like you'd normally think of. They're located here locally, and we're glad to have them on the show and talk about some things that you'll find out in a minute why I want them on here. Welcome to the show, Zach.
Very nice to see you, sir.
Wait, we got to do that again.
There we
Replay.
go.
There you go. Welcome, Kathleen.
Thank
Again, welcome back.
Thank you.
You was on here, what, about 30, 40 years ago?
Something like that.
Seemed like that,
Yes.
doesn't it? Yeah. We're going to talk about substance abuse and disorders that Bradford is well known. I know it personally. What I do know about it has to do with substance abuse and that kind of thing, with behavioral stuff. And I want to talk about what you've got here locally and what it offers and how we go. I hope everybody's got that phone number out there too, because I'll tell them to get the pen 256-237-4209 before we get into everything. So y'all write that number down. Where do you want to start off on this? You tell me.
Well, let me kind of start big picture and just say
Okay.
what
I
Bradford
love big
is.
picture.
Yeah, let's start big, go small. Bradford Health Services is a major provider of substance abuse treatment in the Southeast. We are operating at more than 20 locations across 4 states, many of them in the state of Alabama, including, as you said, here in Oxford, Anniston. And our focus is the substance abuse treatment for adults and adolescents. So that's one thing that makes us different in terms of other treatment providers. And the other thing, another thing that makes us different is a focus that we have on treatment for veterans and first responders specifically. At our inpatient facility in Warrior, Alabama, which is just north of Birmingham, we have a specialty program designed just for veterans and first responders so that they can address their substance abuse issues among a community of their brothers in arms, of their fellow veterans, active military personnel, and current and former first responders.
Explain that to me. Is that a village type thing, or what?
They do live in cottages. They're very, very nice.
Okay.
So they would be housed in one place among their peers. They would be receiving treatment every day on that Warrior campus. And one of the things that is remarkable about Bradford is our continuum of care, because we're talking about big picture and how all this relates among the region, but then how do we bring that back home? And after someone completes an inpatient treatment at Warrior, they can be referred back to their home communities, because we do have regional office locations like the one that Kathleen works at here in Oxford, where we do intensive outpatient treatment, so that we can continue working with that same person along the continuum of care, so that they can get potentially detoxed if that's required. They can go to inpatient residential level of care, and then they can go to something that's a bit less restrictive, where they can be at home with their loved ones. They can be living in sober living, or they can be getting back acclimated to a community so that they can return to work ideally, or they can engage in other activities that are going to help them along their recovery journey.
Kathleen, what you heard Zach talk about veterans and stuff, and that's something very important to me and first responders. But what is the veterans? What I was just watching on TV before I left here this morning. Mm-hmm. The president talking about appointing a czar, if you will, the head of the opioid problem, and making it a disaster situation by calling on all the tools. It's what is how does the veteran get it? Is it prescriptions just telling the doctor to give me this, more of this, or what? How does that work? That's magic. You see,
Yeah.
it's coming up on Halloween. The ghosts coming in.
Well, I don't think there's any one way that it happens. I think that is one of the ways that sometimes happens for our veterans is that they are injured, they're experiencing pain, and they are getting prescriptions for that, and so then that potentially leads them to that. There's also issues where they're struggling, as Zach mentioned, their commonalities are that PTSD and other things related to their service, and the same with first responders. And very often what we know in substance abuse and addiction is that a substance is used to escape from those feelings, those emotions that they are experiencing, those memories. So there's not just one way that someone gets to that point in the road where they have an addiction, but there are many ways. And we know specifically it's very common for our veterans and our first responders to have those other experiences that could lead or be part of that path.
So Zach, in the what Kathleen's talking about there too, and the PTSD that a lot of our veterans are being treated for, you're prescribed things like Xanax, things like that for anxiety, and then a lot of times the medication comes in the form of a bottle or a can. Right. That's the way we see the trend going, like what causes some of these problems.
First responders and veterans are susceptible as anyone else for addiction, if not more so.
More so.
The avenues for which that they become addicted to these substances are the same mechanisms for anybody else. It's a brain disease, and because of that, they're at risk for becoming addicted to any of the substances that anyone else could. Legal and illegal. Yeah. Alcohol included. Alcohol is still the #1 substance that leads folks to seek treatment across the United States. We are seeing ebbs and flows in the treatment community. The big issue that we've been talking about that you've brought up just now and that's been a major issue for more than 10 years is the opioid epidemic. Yeah. And the avenue for which somebody becomes addicted to opiates can start as benign as they were legitimately injured and they became addicted to the medications. In some folks, that means that when those medications run out, they might turn to something like heroin.
Well, see, when I was with the veteran population I'm associated with, I recognized both of them, the substance abuse and the alcohol. But I had another life in the music business where I managed a guy, or booked a guy named George Jones, who ended up in Bradford. Were you aware of that? The country music star.
Even if I was, I couldn't say.
But he lived a lot more years as a result of that. But he was on a downward spiral, and thank God somebody intervened and got him in there. And this is there's a lot of success. I've had some in my personal family that, at least one, that benefited from it. So I know what you're talking about is very, very successful. And in this last minute, the part about how they get, the doctor says, I need something for anxiety, and they give it, they can call it up, 800 number, 888, get it delivered to your house. And that's the start of it, because I don't have to deal with this tonight because I can take Xanax and it's gone. It's like, I've seen people that's taken it and it's like, oh, your dog got killed. Yeah, that's good, I hate to hear that, but it's just, but we run out of time. In this segment, I want to make sure we cover everything, so we're going to go to a break, come back, we're going to talk more with Kathleen and Zach. You stay, get that pen. If you don't need this information, somebody does. Be right back. Welcome back to Veterans Issues, and we're talking with Brad and Kathleen, and we're talking with the Bradford Health Services, and we were talking about veterans and the treatment. And let me ask you, why is it so different? Zach, I'll go to you. Why is it different between, in treating from Bradford's perspective, treating veterans versus civilians?
Treating addiction in general is a complex issue. Whenever we're working with veterans and first responders, we add an additional layer of complexity because when we look at the person's whole history, all of the things that they've gone through, some of the things you've alluded to already with their experiences, some of the things that they may have seen in combat or working on our streets with accidents and violent individuals that they've had to work with as first responders. We're dealing with an aspect of trauma. And oftentimes substances are used as a means of escape, trying to flee from those negative thoughts and feelings as a way to come to some level of balance, some homeostasis, because when you look at how hypervigilant you have to be as a military personnel or as a first responder, they're in a constant state of arousal. Their anxiety levels are high.
On guard.
On guard is a
Yeah.
good way to put it, and that's hard to come off from when your shift is over or when you're back on base.
That goes back to our discussion in the green room there when I was talking about the exiting off of the interstate, and getting back into society.
Absolutely.
Kathleen, when we talk about somebody going through the treatment program, a veteran, then they get to feeling good about themselves. They've cleaned up their act. They're off the substance abuse. They're off of the alcohol, and they come back to the family, and then they start hearing negative vibes from reminding them of their past life that caused the situation now. Is that what do you want to address that?
Sure. So one of the things I think that's really important is that, both you and Zach acknowledge that and mention that, is that one of the things that Bradford does is work with those family members and those significant others and those concerned people in their life to help them understand about the fact that addiction is a disease. And what about the disease? And what can they do? Because in most cases, I think the family members are just trying to figure out what do I do? How do I react differently? I don't have any other way to react in that what I've done before. So Bradford does a great job of really engaging those family members and actively seeking those people that can be a support network for them. Whether they've been in their life before and they need to learn more and understand and be educated, as you mentioned. So here in Oxford Anniston at our office, we have a concerned family member, a concerned person group every Monday night, and someone doesn't have to be in treatment. They could come there and the family member or the concerned person could learn more about the addiction, learn more about the disease, and then also find out about what resources might be available for their person that they're concerned with. And we also have free consultations. I'm going to let Zach discuss that piece a little bit about the bigger picture of Bradford and their family program, because it's bigger in some places.
Before you do, I wanted to tag onto that because
Sure.
I'm old and my train of thought don't stay there very often,
Okay.
but very long. But I'm going to lose some fans out there. If I had 3, I'll probably be down to 2 now. But one thing that this person has said is very important, and it's Hillary Clinton, that it takes a village. And when a veteran is on his way back to get his life back, or her,
Right.
because I know some females that have been through this situation, when they're back, they need to have their arms wrapped around them, not just to the family, but everybody at the church and everybody in that village, neighbors. And they need to, attaboy, they need to, like the way you cut your grass, Joe. Man, you're looking good now. These are the things that it's going to take to get Joe back on his feet. So it's the people that's watching out there. It's all of our, this person. I say that all wounds are not visible.
Right.
When this person's walking away around with this kind of stuff, you don't see what it is. But if you could go across in Southeast Asia, you could see exactly where the wound is without it being visible, and you don't know what's on their mind. So if there is a way to treat it, and sometimes they take the easiest route, and that's to the bottle or the pill. And so to break that cycle, that's where you guys come in. You go ahead with that.
Absolutely, and that goes back to the complexity, because the wounds are internal a lot of the times. And earlier we were discussing about how some of those wounds come out in different kinds of behavior, and that's maybe what that family member is experiencing. They're experiencing the rage or the disconnect. But what they are saying is, my family member isn't the same. Something has changed. And that's what they recognize. And that can be a sign of drugs and alcohol in general, But especially when we're talking about veterans and first responders, that can also be a sign of some underlying trauma.
You could see both ends of the spectrum. You can have anger lashing out
Yeah.
to withdrawals,
Yes.
and they work both ways. Where somebody just, I don't want them.
Yeah.
Joe's coming over to the house. I don't want kids. No, I don't want to come. They want to sit there in a recliner with the remote. And they don't
Right.
want to. And that's another sign that people need to look at. And then the other one is the road rage that we talked about, and yelling at the kids, yelling at the spouse. It shows up in a lot of different.
Sure. And family members will always struggle with, which one is it? Is it the trauma and the PTSD, or is it the drug and alcohol
Right.
use? And it's impossible to separate the two.
Both.
Right.
We talk, both. We talk about chicken or the egg, kind of which one came first.
Yeah.
And there's no way of really being able to separate the two. And in the end, we have to treat both together. You have to
because
treat the
you're not
whole
gonna-
person.
You're not going to get rid of the lashing out and the anger and all that withdrawal and stuff if you don't deal with the real problem that got it there. That's that crutch that they're using. And in your mind, if anybody out there has ever been addicted to cigarettes like I have, the mind tells you why you want that cigarette. I mean, you see somebody with a cigarette, you don't really want one, but your mind tells you do. And that's the same thing with, you don't need a pain pill. And you start on the bed and you go back and say, well, I don't want to wake up in the middle of the night, so I'll go take a pain pill.
Right.
And the same thing about sleeping medicine or anxiety medicine, it works the same way.
Right.
And I think a big part of what we do at Bradford and in our role is we're like hope merchants,
Yeah.
We let the community and the families know, and our patients know, veterans, EMS, first responders, that there is hope, that they don't have to live the rest of their life this way, and that there are services to provide that support for them. We have
But
a
I want to look
24-hour.
over there, and I want that camera. I want to look right at the camera, and I want to tell every veteran that's listening to this, to have a problem that we're talking about here should be worn as a badge of honor. You didn't get that because you're sorry and you're crazy and you're low down, no good. You did that because you're serving this country. Would you not agree?
Yes.
Absolutely.
We
And if
completely
they
agree.
don't want to feel, we don't want them to feel like they losing, and we don't want the community looking at them like that.
Right.
But,
I especially want to carry the message out to your viewers is that we offer free consultative services.
okay. And this, I forgot to do this. Your insurance does cover this.
We do accept most major insurances, yes, and as part of that free consultative services, that's one of the things that we can help address. If you are a family member, or if you yourself are concerned about drug or alcohol use, look at our website, bradfordhealth.com. I believe the phone number for us is up on the screen as well. It's a free call. We can get you in to speak with somebody immediately.
Or they can call me and I'll get back at you. We're running out of time.
All right.
I appreciate you being on the show.
Thank
today.
you very much.
Learned a lot. And you gonna come back again? Will
Absolutely.
you bring this guy with you?
I will,
I
absolutely.
got you on TV saying that.
I know, you
so
do.
I can hold you to it.
Now, well, he'll come back though, right?
I'll do my very best.
Yes,
He
that's
said
right.
he would. That's all we got to do. I appreciate it. We got to go to a break. We're gonna come back with news that you can use. Get a pen. Be right back. Welcome back to Veterans Issues. Appreciate Kathleen and Zach coming on and doing the show today. We're gonna have them back on here again because we left a lot of things on the table. I'll be talking to you about them later, but this is very important stuff. We got to take care of those veterans out there, and we're going to take care of the population as a whole because they need to understand what's going on out there. I want to give you this veterans hotline. This is the number that's at the White House. It's 855-948-2311. 855-948-2311. That's a coverall phone line there at the White House. And the crisis line for suicide or somebody that's intended to harm themselves, this is a number that everybody needs to have available. It's 1-800-273-8255. And when voice comes on, press 1. 800-273-8255. Write that number down and press 1 when you get the voice on it. Don't forget that November the 11th at 11 a.m. in Centennial Memorial Park, we're going to have our Veterans Day ceremony. This will be the 27th annual, and they're going to have some great music. And then right after that, that'll be over around 12 o'clock or so. It'll give you plenty of time to go get you a burger or whatever, and then going down to Noble Street and watch the fantastic Veterans Day Parade. Now, this parade's going to start up on 22nd Street. It used to start at like 18th. That ought to tell you something. We're going up 5 more blocks because we got more entrants this year. Got 3 more high school bands than we've ever had. So we got a lot of stuff going on for that day. So November the 11th, just plan the whole day to spend with us. You'll be through about 4 o'clock down there on Noble Street. There'll be plenty of vendors and whatever, but get you a bite after you finish up at our ceremony and go on down and enjoy the day. Write this website down. It's all one word, Wounded Warriors Alabama. Wounded Warrior Alabama. Not Warriors, but Wounded Warrior Alabama at gmail.com. Phone number is 256-458-2715. Now, this organization is called Wounded Warrior, but you don't have to be a wounded warrior to get help. Last week, they were helping a veteran that needed a ramp built to their house. Ross Winter, who's a businessman here locally, most of you know him, is also a veteran, and he has financed this himself, and they also take contributions. This is a good time of the year if you'd like to help that great organization with your tax write-off. They're 501c3. That's where you need to put your funds because it actually works here in the community, and they in the state of Alabama, and they do great work. And I'm glad to know that we got somebody out there like that I can call on when I got a veteran in need. The clinic wanted me to remind you about the flu season, about wiping your hands. I often tell you about when you grab a buggy at the grocery store or Walmart or whatever, and the handle's nice and warm in the cold weather, guess what? Somebody just had their hands on that. And you don't know if it was up here in their nose, whatever, but think about that the next time you grab a shopping cart. And then the bathroom doors and all that thing. So wash those hands. They advised me to tell you to hum a verse of Old MacDonald Had a Farm, and that'll get you through what you need to do while you're washing your hands, not just to run the water over them, whatever. But this is the season, folks, and most of you are up there in age. You don't need to have any of that. Now, I talk about the Firefighters Memorial. The Alabama Law Firefighters Memorial will be up here in Centennial Memorial Park by the end of this month. We should have the wall finished up there, but we'll be waiting on the names to be engraved on the marble. So let's see. I still need wheelchairs. Don't forget your law enforcement tag when you go get your new card. Now, I was going to talk with Zach and Kathleen about the choice card. I'll do that later. But go get you a choice card, folks. Let's see. This I'm trying to find out. This week's salute goes out to all the folks up at Bradford Healthcare that help our veterans out. We'll see you next week right here on Veterans Issues. Salute. We're gone.